I am Dr. Alex Owen. I am an Associate Specialist in Dermatology at Gloucestershire Hospitals. This is a fairly big dermatology department. We have 7 consultants and a lot of middle grade doctors and specialist nurses. We're a big cancer centre for skin. We also do a big inflammatory department as well. I see 200 patients roughly monthly. So the documentation I need to complete is mostly clinical letters, which will usually be to the GP and copied to the patient. And also I do a lot of writing of letters to patients about results. So the most important benefit for this software is the ability to see your clinical letter in real time. So you're able to provide better quality of care for our patients because you can see your letter immediately while the clinical details are very fresh in your mind when you've just seen the patient. You can make sure that the letter is complete and perfect before moving on to the next patient, which we never had that facility previously. Dragon Medical One does allow us to provide excellent documentation, which is available for all relevant people, including the patient, the GP, the hospital record, and this will definitely improve our quality of care. Dragon Medical One can improve not only the quality of the letter, but also reduces the amount of time taken to dictate the letter. I also find Dragon Medical One useful for any other dictation or emails. We do a lot of what's called advice and guidance, which is where GPs will send us photographs of skin lesions for us to diagnose. And I use Dragon Medical One to dictate into that interface, which is a different interface to our normal letters, but it's on a thing called ERS, which is the referral platform for the NHS. It works. You can just dictate into ERS, so my reply to any GP query comes off Dragon Medical One. And in addition, I can use auto text templates within Dragon. So if I'm getting a very common request from a GP about a particular skin lesion, and it's rather than repeating myself, I can just tell Dragon to put in my usual response to, say, an actinic keratosis, which would apply to all of these cases. So that saves me a lot of time. I do find that Dragon Medical One is functional within all of our IT systems where input is required. So where you would normally use a keyboard to type anything into any platform, Dragon works for all of those. In terms of the impact on the medical secretaries, it's become a lot easier to type up letters because they are complete when they see the letter. They're massive time saving for them in terms of how they process letters. So we started the project with Dragon Medical One as a small group project with 4 doctors about 18 months ago, and I understand we now have around 200 users across the trust, so it's becoming more widely used. Every week we have a multidisciplinary meeting for skin cancer, and it's very important during those meetings when you're discussing results to know all the details about the patient. We get the clinic letter up on the screen in front of the whole committee to discuss the results, but also all the other clinical details in terms of how well the patient is, their other medical history, and all of that comes down to the clinic letter. And because the clinic letters, which I've been dictating with Dragon Medical One, are excellent, it really has helped in those meetings, because if you don't have that information at hand in that meeting, it's impossible for me to remember every single detail of every single patient. Whereas if you've done a very good clinic letter, that makes a huge difference. Voice Power have been incredibly supportive. When we started the project, Voice Power provided us with an excellent representative who was incredibly helpful in training and helping us set up all the templates. And whenever I've had any issues, I have emailed him and he's got back to me almost immediately and has been able to log in remotely and fix whatever the problem was.